People assume walking into a Chinese hospital with no Chinese language skills and needing an MRI means a long, confusing morning. What actually creates the confusion isn't the language, it's not knowing the sequence. Brain MRI is one of the departments I prepare for most carefully, because the workflow has specific steps that need to happen in the right order for the morning to move smoothly. Before the patient arrives, I confirm the appointment code and verify the exact floor and room number with the department directly. MRI suites occasionally shift between buildings, depending on equipment scheduling, and discovering that change at 8 a.m. rather than the evening before makes a significant difference to how the morning starts. I always confirm the appointment code the evening before every imaging appointment. One time, a reschedule hadn't been updated in the system. We caught it at 9 p.m. That's a very different problem to discover at 8 a.m. with a patient waiting. On the day, I walk the patient through the metal and implant checklist before we reach the department. Not because the staff won't do it, but because going through it beforehand means the patient arrives informed rather than startled by the questions. Hearing, "Do you have any metal implants?" for the first time while standing outside a scan room feels different from having that conversation calmly in a corridor 10 minutes earlier. One detail that takes first-time visitors by surprise: the waiting area for MRI in most Chengdu hospitals is quieter and smaller than patients expect. There's no drama to it. People sit, they wait, they're called by number. Before we leave the department, I always confirm whether the report releases digitally or requires in-person collection. Getting this wrong means coming back, which is a significant inconvenience for anyone with a flight scheduled. An MRI morning handled well is one the patient barely remembers as stressful. That's exactly the goal.